This is Heart Rhythm TV in Yokohama, and your wrap-up starts now. This is Heart Rhythm TV. We are coming to you day 2 in Yokohama for the JHRS, APHRS. Heart Rhythm TV is here as we are everywhere, and we've got a lot of things to cover. These are the type of things that are happening on the day-to-day in this wonderful, beautiful city. Welcome, JC and Alessandra.
Thank you.
Honored to be here.
I think that we can get right to late breakers because I was there for day 1 of late breakers and a lot of device-heavy late breaking. We had something from Indonesia called the Prime Score looking at the various predictors of recovery with conduction system pacing, highlighting obviously LV dimensions, ischemic cardiomyopathy, really low EFs as non-responders. And that was really important to see all the data we've seen with BIV now applied to conduction system pacing. We also saw a very interesting study from Wenzhou, China, which was randomized ablate and pace versus PVI first time for persistent AFib, which is definitely interesting and provocative because we know the rates of persistent success may be only 50%, and it's more durable with AV node ablation. Showed very comparable outcomes, but not randomized. And there's an advocate study by Haran Buri that's planned for that as well, and Jason Andrade has one planned with myself, so that'll be fun, looking at new strategies for AFib ablation. And then there was this really large Japanese CRT trial that was looking at a registry that was really looking at the largest predictors of recovery, typically the traditional. But it's nice to see all of this data and the generalizability across cultures, across ethnicities, race, you name it, as it's a very global mission here.
Yeah, I agree. And today's late breaker session was also very device focused, and there was a lot of real world data. And all the trials were about non-transvenous devices, which is very exciting. There were 2 trials covering leadless pacemakers. One was real-world data on the APHRS, or dual-chamber leadless, and very promising results. And the other one actually evaluated how this is applicable to patients that are under 65 years old, which is not the usual cohort of patients that in the real world we're actually implanting maybe these pacemakers for. But the results were very promising as well.
And what's interesting about that is we're seeing this second wave of technology. You know, a lot of it starts in Eastern Europe, and we never see it. Then the U.S. is trying to get some, and then it goes to Europe sometimes before the U.S., like PFA did. And now you're seeing this wave come across Asia. And that's what's an interesting case study for us, is to see the adoption and the penetration of it. Being Asian and having done work here, there's a lot of reservations about accepting implanted devices on the chest. And you have different cultural aspects of it. So I'm not surprised to see a really broad, quick uptick of leadless devices here. And it was good to see the safety of it.
Yeah, and then there was a very novel technology, which is the modular ATP trial that actually combined the standard SICD with the leadless pacemaker that can communicate with the SICD and pace and deliver ATP, which is one of the downsides of the SICD, where you had the late breakers as well, right?
Yeah. The issue that Michael Lodi present that, and you can see that using the subcutaneous ICD, you have another tool to do ATP as well. And in these patients, ATP was successful to revert in primary prevention, like 77% of the cases.
Yes.
So it's an option that you can do, that you can have to try to treat the ventricular arrhythmias, even with subcutaneous ICD.
Yeah, and that's a great extension, done by Michael Lloyd from the original New England Journal of Medicine paper. So it's great to see that presented at APHRS, like late-breaking science. Yeah. That's what's pretty awesome. You were also in some joint sessions.
Yeah, we have joint sessions with the World Society of Arrhythmias, talking about the expectations of the electrophysiology in the next 10 years. Then ERA with APHRS talk about conduction system pacing, abroading subjects about is conduction system pacing needed for all the patients with ventricular stimulation, and also if you can use leadless pacemaker even in patients with tricuspid insufficiency of the valve. And we got the Latin America Heart Rhythm Society and APHRS. We're going to be treating the subjects about how to avoid the synchrony with pacing and maybe with other options as cardiac ablation.
And the other cool thing about just being here, obviously, in person and connecting is I saw Dr. Weijin Wang, who's the Wang technique, and he was whispering that he's got some new strategies like distal his pacing. So you get a little bit of some secrets of things that are being developed, because if you think about it, left bundle area pacing was something that originated from China and comes all the way through, and we were late adopters. So it's fun to see these global shifts and see what's actually trending. One thing that's been pretty quiet is PFA.
Yeah.
And
I think it's coming tomorrow,
it's
right?
the PFA wave is coming tomorrow, and obviously there's so many different companies in Asia when you think about the market here,
Yeah.
which is so different, and I'm sure we'll hear a lot more about that tomorrow.
For sure.
Well, that's a lot from day 1 and 2 in this book. Late-breaking science, some simultaneous publications. We had great electrograms, even with just small case studies with so many people from all over Asia. Some great commentary from India, just commenting on the Maheims, the weird bypass tracks, the concealed notoventriculars, funnel branch reentry, reverse Kummels. We were in that session.
I
Some
think it's
really
always good to be active with your brain and just look at those EGs.
And going back to the AKG, there is one.
And there's a lot of attention to that in Asia, which I want to make sure we continue that in the U.S. as we train. But late-breaking science, global collaborations. We got a big faculty event tonight. It's been great to be in the city of Yokohama, and it's fun to see all the excitement.
Absolutely. See you tomorrow.
Yes.